and welcome to the University of Suffolk Business Engagement Podcast. I'm Gemma Matten, Business Engagement Manager here at the University of Suffolk. And today we're talking about an exciting professional development opportunity, our Non-Medical Prescribing course. I'm delighted to be joined by Dr Georgina Marsh, who is the Head of Pharmacy and Prescribing. Georgina, thank you so much for joining me.
Thank you for having me.
So Georgina, could you start by introducing yourself and telling us a little bit about your role here at the University of Suffolk?
Of course. So I'm Georgina Marsh. I'm the Head of Pharmacy and Prescribing here at the University of Suffolk. And I'm a pharmacist by background. And I've been involved in developing and designing the new MPharm program that's due to start this September, as well as leading the non-medical prescribing and pharmacist independent prescribing programs that we offer here at the university. And I'm really excited to talk to you today about our non-medical prescribing programs.
Fabulous. So obviously, as you just said, we are talking about the non-medical prescribing course. So for those that are unfamiliar with it, who is it for and why is it so important?
So the non-medical prescribing course is designed for eligible healthcare practitioners. So that could be pharmacists, nurses, midwives, and allied health professions, for them to gain that kind of independent and supplementary prescribing annotation with their regulator. And it's really important for those that are hoping to operate at the top of their license within their scope of practice and really advance their clinical progression.
That's fabulous. So what knowledge, skills and confidence do participants typically gain from completing the course?
So the course really is obviously designed to help non-medical prescribers to develop their prescribing practices. The course is structured around gaining consultation and communication skills, clinical reasoning, and also the ability to prescribe in a safe and effective way. So our course is fully accredited by the General Pharmaceutical Council, the Nursing and Midwifery Council, and the Healthcare Professions Council. And as part of that, we align ourselves to the Royal Pharmaceutical Society, now the Royal College of Pharmacy's, Prescribing Competency Framework 2021. So the course is designed around three core themes. We have the clinical pharmacology, so understanding how obviously the medicines actually work in the body. We have the legal, ethical, and professional practice side of things. And we also have the medicines optimization and governance strands of the course. And we're really, really lucky here at the University of Suffolk that all of our professions learn together. So it really creates a nice multidisciplinary environment, which I think improves confidence in prescribing as part of a multidisciplinary team.
So why is non-medical prescribing becoming increasingly important across health and care services?
So I think we all know that the healthcare system and the NHS is under a lot of demand and workforce pressures at the moment. And actually what this course allows is for healthcare professionals that are already in the system to really use their skill set to the maximum in order to help patients and to provide the best possible care for patients. Non-medical prescribing is really essential criteria for the NHS long-term workforce plan to really come into effect. So traditionally, doctors have been the lead prescribers, but actually it's important that the other healthcare professions actually can use their skill set to provide the best patient care, and non-medical prescribing is one of those tools that allows them to do that. By increasing the number of safe, effective prescribers, it helps to obviously improve patient access to services so that patients get the person to give them the diagnosis, the kind of treatment options, and really the follow-up all with that same clinician, as opposed to having to move around the NHS and cause strain on the system. And obviously, hopefully should provide better outcomes across both staff workload, but also for patient outcome and well-being.
Absolutely. And obviously there is a big push at the moment for that community healthcare that's going to be going out. So you can see how this could benefit that moving forward. So what sort of time commitment should participants expect over the 6-month length of the course?
Yes, so the course is 6 months and it's over 26 structured days. So those include 20 contact days where participants will have a range of workshops and lectures to learn the theory of the course. But obviously on top of that, we also do some online structured days so that participants can, in their own time, work through a series of different additional elements to upskill themselves on things like genomics in prescribing. And then in addition to that, they'll also have their supervised practice elements in order to convert that theory into practice.
Fabulous. There is also, as you say, some supervised practice elements. So can you explain what that involves and how important that support actually is?
Definitely. So Obviously, prescribing is a practical skill. So although we teach the theory, it's important that our students have the opportunity to implement that in practice in a safe and controlled way under the supervision. So during the course, they'll have 78 or 90 hours, depending on their regulator, of supervised practice. And this will be in a practice learning environment relevant to their scope of practice. So whatever specialty they want to take forward in terms of their prescribing. They'll have support from a designated prescribing practitioner, or DPP, someone who's an experienced prescriber overseeing their development and progression through their prescribing elements and competencies. Tied with that, they also then have a personal academic coach who is their contact and support as part of the university, who again will touch base with both the DPP and the student to ensure that they're progressing through the course and giving them the support they need to make sure that they're reaching the prescribing competencies by the end of the NMP course.
Yeah, and that's something that's so important, obviously, for the employee and the employer, knowing that they've just got all of that support there surrounding them. So what are the biggest benefits for someone who completes the course?
So completing the course, obviously, you'll have that independent and supplementary prescribing annotation. And what that really allows is greater clinical autonomy. So really being able to operate within your scope of practice at that higher level. And what that generally means is that you're more eligible for advanced clinical roles. And so a lot of people find that it allows them to progress with their career, but also it provides a better, enhanced patient experience as well.
How can becoming a qualified prescriber actually support the career progression? I know obviously you said it could lead to that. And how does it support their professional development as well?
Yeah, so it obviously signals a readiness for advanced practice. So as part of applying for the course, you have to already show a significant experience in your practice. And then we also include non-medical prescribing as a module on our district nursing and advanced clinical practitioner course. So it's often considered as part of that structured pathway to more advanced clinical roles. A lot of the time, it's important, for instance, for Band 7 to Band 8A promotions. So all of that indicates a readiness for specialist and leadership roles within whichever sector of practice that the person's working in. But it also means that you've got that portfolio of evidence in terms of your competencies and your ability to do that kind of clinical reasoning, and you're not just protocol driven. You also have that ability to make those informed decisions in terms of prescribing consultations. And as part of the course, it's really emphasized that as prescribers, there is that need for continuing professional development. And so that's something that we do is also encourage them to be reflective practitioners and really learn and grow from the experience of the course and their education.
So that's great as an employee's perspective. So from an employer's perspective, what difference can it actually make to have more non-medical prescribers within a team or organisation?
So I think it's hugely beneficial from an employer's perspective as well. It creates a more flexible workforce, and it helps reduce bottlenecks and unnecessary duplication, where previously you may have needed to refer or signpost to another clinician who then will have to review the patient again in order to write the prescription. This now gives the individual who's doing the initial assessment that autonomy to actually write their own prescription. And so that will obviously produce a more enhanced service for the patient, better patient experience. So no unnecessary scheduling of multiple appointments to discuss the same issue. But also it will mean that it's more seamless service delivery as well, where one clinician can be responsible for the whole pathway for that patient. And so ultimately that will reduce staff workload, but also improve patient satisfaction, which is realistically what employers are looking for.
Yeah. So it's hugely beneficial. What should prospective applicants know about funding and course costs?
So it can really depend on the profession. So a lot of people may have funding through their employers. So I'd really encourage people to have that discussion with their education and training lead around funding pathways. Or people can actually self-fund and obviously pay for the module as an independent module for their career progression.
Are there any entry requirements or preparations that people should think about before they apply for this course?
Definitely. So it's really important that people get themselves prepared. So I always encourage people to think about things and get everything in line as early as possible. And then that way they're fully prepared for the entry of non-medical prescribing. One thing, obviously, they have to be a registered healthcare profession with sufficient experience. So for the Nursing and Midwifery Council, that's 1 year of experience. For others, it's sufficient clinical experience within their scope of practice. On top of that, they have to make sure that they've got an up-to-date DBS within the last 3 years. But I think the thing that really can take the time is finding a good designated prescribing practitioner or DPP within their scope of practice. So someone who can actually supervise their practice elements. And so finding that person, someone that you'll be working with for the next 6 months and who can support your development in your area. And obviously making sure that the practice learning environment is somewhere suitable for you to be doing your practice elements. So making sure it's either got CQC inspections or GPHC inspections to make sure it abides by the regulatory expectations. And then finally, ensuring that you're actually at the right level in terms of having evidence of level 7 academic ability. So that might well be having done recent CPD modules and obviously having completed your degree. Finally, the one thing I would advise people to do is make sure they talk to their employer, because it's really important to get the employer's support for that protected learning time to make sure that you can really dedicate the time needed for the course. So those 26 structured learning days and obviously your prescribing practice hours.
And then finally, if someone is listening and considering taking that next step, what would you say to encourage them to apply for the course?
So I suppose if in your practice you're already starting to make those complex clinical decisions and you're ready to move towards those more advanced specialist roles, then apply. Take the time, decide on your scope of practice, so the area that you really want to prescribe in, find a DPP, talk to your employer, and apply to the University of Suffolk.
Fabulous. So thank you so much, Georgina. It's clear how impactful this programme can be for both the individuals and organisations that they work within. So if you'd like to find out more about the CPD module, you can visit the University of Suffolk's website or contact the Business Engagement team directly. Thank you for listening, and we'll see you next time at the University of Suffolk's Business Engagement podcast.